Today I'm going to be demonstrating how to give an intradermal injection, such as the kind you give when you give a PPD. A PPD is a screening tool for tuberculosis. By the time this video is over and you've had a chance to practice a few times, I hope all you new nurses will feel confident in giving a PPD to your clients. According to the Handbook of Adolescent Healthcare, all high-risk individuals should have a PPD done yearly. What constitutes a high-risk individual? Pregnant women, for one, healthcare workers, people that have lived in dorms, prisons, or homeless shelters, and people that have lived in an area where tuberculosis has a high prevalence. Okay, before we get started, you're going to want to gather all your supplies. You want to gather all your supplies ahead of time so you're not running in and out of the patient's room. So here's my supplies here. I have a pair of gloves, my tuberculin syringe, a couple alcohol wipes, our PPD derivative right here, a few gauze pads, and a hot dog. A hot dog is a weird supply, but Ms. Julie Monsignor, the lab assistant at PHSC West Campus, told me many years ago that a hot dog or a sausage with the skin is very good to practice on. It mimics the patient's skin almost identical. You have the meat and you have the skin on top. Okay, so we go into our room, we wash our hands. We tell our client, Mrs. Jones, "Hi, Mrs. Jones, I'm here. My name is Jessica, and I'm here today to give you a PPD." You're going to want to get her consent and answer any questions that she may have about the PPD. So now that we've washed our hands and explained, you're going to glove up. You're going to want to open your syringe. This one here is a 1 milliliter vanishing point tuberculin syringe. This is a very, very small needle designed specifically to give PPDs. So next, what we're going to do is clean our patient's arm and the bottle of PPD. You're going to start in the middle and you're going to go outward in a circular motion for 15 seconds. Now that the arm is clean, we can go ahead and clean the top of the PPD solution. You're going to start in the middle once again and go outward for 15 seconds. All right, I have done PPDs for very, very many years now, and I'm going to tell you new nurses a little trick that I've learned over the years. The standard area to give a PPD is your left inner arm, your left forearm. So you're going to want to ask your client or your patient to lay their left forearm, whether it's in a doctor's office or at the bedside. You're going to want to have them lay it flat on the table, and you're going to take your other hand and you're going to spread the skin out, and once you inject the syringe just under the skin, that's when you're going to leave it go. You're going to get a nice wheal there. What a wheal is a little pocket of fluid directly under the top layer of the skin. And I'm going to try this on the hot dog, which isn't an exact replica of the human skin, but it's pretty darn close. All right, so first you're going to want to have your solution down flat on the ground, on the table, and you're going to put the syringe in. Now, these syringe comes automatically pulled back to 0.1, and 0.1 is the most common dosage for the PPD. So and inside of that, that's air. So you're going to want to transfer this air up into this bottle. You're going to push it up. And there we go. Now you put the air up in here. Now you're going to draw the fluid down into the syringe. You can go past. I always go past. You want to go past 0.1 and you can push it back up. That gets most of the bubbles out, and you can play with it a little bit. I don't know if you can see those bubbles in there, but you can play around with it till you get all the bubbles out, and I got most of them out. There's always one that hang around at the top. All right, down. We're going to make sure we got all the bubbles out. Flick it a couple times and get that nice first drop out. All right, these needles have a beveled edge. Beveled means it's at an angle. So now we have the angle pointed up, and here's Mrs. Jones' arms. I'm going to take my non-dominant hand and I'm going to spread her skin, her forearm, just like that. And I'm going to come in an angle almost perpendicular to her arm. We don't want to come down at a 90 degree. It would go in way too deep. We don't want to be at a 45. We want almost maybe a 10 degree angle. All right, you're going to come in, squeeze, spread her skin, go right under the skin and inject. Let's see if we get a nice wheel. Oh, well, it came out the skin. That doesn't happen on a real person. You would get a little tiny bubble there. All right. So these needles are nice. You're never supposed to recap your needle. That's a big no-no in healthcare. These ones are really nice. If you just keep pushing that, give it a little push, this side disappears. See, there you go. No recapping those needles. So now we're going to give Mrs. Jones a little gauze pad. There you go, Miss Jones, to sop up the water. I mean the PPD. We're going to tell Mrs. Jones not to use hand lotion on her arm. She doesn't want to rub or pick at her arm, because in 48 to 72 hours, we're going to come back to Mrs. Jones. Us or a different nurse will come back to have the test read. Now, how do you read a test? You have, you need to bring a measuring device with you. You're going to measure the area. Now, this is where it gets confusing. A lot of new nurses think that if it's reddened, that constitutes that it's a positive test. That is not true. It's positive when it has an area of induration. Induration is a hardened lump. So you're going to have to touch your client to feel the area. You're going to run your finger down the forearm. And if you do not feel any hardened area, that's a negative. Now, if you feel a little tiny bump, what you're going to take your little measuring device and measure. Some packages have it on, this does not. You're going to measure the area. So if it's more than 5 millimeters, that would be positive. If it's more than 5 millimeters, you're going to want to schedule a chest x-ray for Mrs. Jones, or possibly a sputum culture for Mrs. Jones. You're going to assure Mrs. Jones that she shouldn't be alarmed, and that many positive PPDs come back because the person has been around somebody that has been a carrier of tuberculosis. Not necessarily the disease, but they're just a carrier. So you're going to want to schedule those tests for her before she leaves the office or before she leaves your facility. All right. So all you new nurses, we went through. I told you, I showed you how to do the PPD. I told you how, what type of people that need PPDs done yearly. And I showed you how to read a PPD in 48 to 72 hours. So I hope this has helped all you new nurses become more comfortable in this skill. Thank you.